Dear colleagues, it's my great pleasure to present a few insights from our work at mTMADI at this year's Global Digital Development Summit. My name is Samuel Knaus. I'm a neurologist and a global health researcher at the Charité University Hospital in Berlin, Germany. Today, I will be joined by Phyllis Nöster, one of our lead software developers at the mTMADI Social Enterprise. One of the biggest challenges to achieve the goal of universal health coverage is a lack of financial protection for healthcare costs or the free access to healthcare, leaving many vulnerable to catastrophic health expenditure and often precluding them from seeking care. And this is despite over 25,000 private or public coverage schemes available in sub-Saharan Africa that could potentially provide this protection. But the processes to administer this are still mostly based on pen and paper, and this means long transportation times and loss of data. In case of illness, a patient has to walk sometimes for hours or even days to reach the next office to request coverage, and lack of data also means a high risk of leakage and potentially fraud. But probably most importantly, it's difficult to reach and enroll a significant part of the population, in particular in rural areas, leading to resource and risk pool fragmentation. This is why we set out to build mTMADI, a multi-payer platform built from the ground up around the beneficiary's perspective. It enables everyone to connect to different health financing mechanisms, including public and government-funded programs, as well as to private insurers from a simple mobile phone or by just owning a SIM card. In case a coverage scheme requires co-payments or premiums, beneficiaries can send this and pay for the costs easily over mobile money and use a health savings account at mTMADI to save up specifically for healthcare in advance. In case of illness, beneficiaries can authenticate at the healthcare provider, and providers can file claims and transmit data over a web-based tablet application. Coverage scheme managers can adjudicate claims online, trigger provider payment, and receive important data insight from the platform. mTMADI started in 2019 as a project of an NGO and now is the largest digital health financing platform in Madagascar. Now I would like to hand over to Phyllis to talk about 3 of our key learnings when implementing mTMADI in Madagascar.
The main aim of our talk is to share some of the learnings and the challenges that we've encountered when building and implementing a digital solution for healthcare financing in Madagascar. We want to give some input and food for thought to people that are either active in that field or that would like to be. We're drawing our experience from the digital healthcare space, but we believe that many of our learnings are applicable in other areas of interest as well. We've identified 3 general guidelines that helped us be successful, or when not followed, led to challenges that we had to deal with. Firstly, we think it is essential to not focus on technology, but to focus on solutions. While the mTMADI platform was technology-based from the start, technology is simply the method that we're using to achieve our goal, which is lowering financial barriers to healthcare. Not everything necessarily requires a new tool, and in certain situations, it's easier to use what's already there and what's already working for people. For instance, to interact with agents on the ground, it is more effective for us to simply set up a WhatsApp group with them than to create a separate tool where they can submit their concerns. When building an application does seem like a viable solution to your problem, a necessary next step is for you to evaluate the technological infrastructure people have access to on the ground and how they use those tools. People don't have smartphones? Well, maybe building an Android app is not that great for them. Video-based doctor consultations are nice in theory and are a great way to reach many people, but they don't work well in remote areas where there's a lack of internet connection. When we're working with low-tech solutions, it doesn't necessarily mean that we cannot build innovative technological tools that we find exciting and effective. By identifying technological tools that users on the ground have available to them, we can bridge between high-level modern technologies and the tools that are readily available on the ground. This then brings the benefit of advanced and upcoming technologies to our users that have low-level technical equipment. An example. At mTMADI, our problem was that limited access to internet connection was an issue for our users, and they didn't have smartphones. We're using ussd as a solution to build a bridge between our users and our platform. ussd is a very basic interactive user interface that works on feature phones, and it doesn't require any internet connection. It's actually rarely used in the global north anymore, but it is still a very popular tool in Madagascar and in many other African countries. The solution was simple. We integrated our application with the existing technological infrastructure, ussd. Patients now use ussd on a simple feature phone to sign up to health programs and to save and spend money and manage their digital health wallet. Having implemented this ussd menu for user interaction of patients, we still faced another challenge. Some of the hospitals that we work with are in very remote areas that don't have internet access. How can we help these hospitals to access and use our web application? Here again, we're using ussd, but in a little more unconventional way. Healthcare providers that use our applications on tablets have SIM cards in these tablets. So they have phone coverage, but they don't have internet coverage always. When there is no internet connection, our custom-built ussd API allows people at hospitals to send and receive data over ussd. This means that they can send information that would usually be sent over the internet over what is essentially just a text message. In this way, ussd serves as a bridge for us, allowing patients and hospitals to connect with an application that they would otherwise not be able to access. Another lesson that we learned is that we want to build for failure. It's really important to come to terms with the fact that things aren't always going to work out the way that you planned and envisioned them. This is especially true when you're building an application for an area with a lot of internet issues and low digital literacy. These are conditions that are sometimes difficult for us to simulate and test. So rather than trying to build an application that never fails, we want to focus on building an application that is fault tolerant and that can recover quickly when it does fail. Something that is particularly important in that regard is also to reduce dependencies on external systems that we cannot control. It means that when we're designing flows, we also want to have workarounds that help us remain functional if external partners are experiencing issues. As an example, in the initial phase of our project, we used to send a lot of crucial information over SMS. When a beneficiary, for instance, received care, they would then receive a TAN code via SMS that they could use to authorize payments at a hospital. So when telecom providers' text messaging API was unavailable, which happened quite regularly, our users were barred from accessing healthcare services altogether because they could no longer pay. As a solution, we are now displaying TAN codes in a ussd menu that the patients can access rather than sending them via SMS. This way, we manage to get less dependent on the availability of the SMS API of our partners. Building for failure also means that we want to be able to support users quickly when needed. Beyond simply keeping the application up and running, supporting users fast when issues arise is really a matter of trust. Ideally, we want to know of existing issues before our users contact us and complain about them. This requires us to have comprehensive monitoring across our application, but also sometimes beyond the services that we've built ourselves. Although the availability of our ussd menu, for instance, is provided by partnering telecom providers, we found that they often fail to inform us when something doesn't work out. In order to notice issues related to the ussd menu fast and minimize the impact to our users, we built our own tool to monitor it. Every few minutes, a Raspberry Pi calls our ussd menu and mimics user behavior. When a user flow is not working as expected, it notifies us and we can respond fast. Of course, having consistent uptime and monitoring provided by the telecom providers would be really great, but pushing for that type of change in a large, well-established company can be a time-consuming process, and it will not help our users access their ussd menu right now. In addition to monitoring, it is important for users to know who they can talk to when they face an issue. We offer a help hotline that users can call for free and have WhatsApp groups that healthcare workers can use to connect to us. But beyond communication with our users, it matters how the feedback from our users travels throughout our organization. Operational issues are not just a responsibility of dedicated people, but they are a responsibility of our whole team. Therefore, we also have developers in our support WhatsApp groups, and we aim to use the same tools for communication and reporting throughout our organization. This helps us to connect and work together across areas of responsibility. Finally, people don't always love change. Especially when digital literacy is low, picking up technical tools comes with certain challenges and frustrations. You can ask my mom about that, who recently downloaded Skype. By having training personnel on the ground that can help them get started and jump in when necessary, it's possible to ease the onboarding process and to teach people how to use tools effectively to meet their own needs. Besides this in-person support, being able to provide remote support and to manage hardware from afar is particularly crucial when we're building software solutions for remote areas. Actually, during the first outbreak of COVID-19, we even experienced an increasing necessity for that in the capital of Madagascar, where our project is based. When traveling and public transport were restricted due to the regulations, our team on the ground was sometimes facing issues traveling to hospitals that are just half an hour from our office. Thus, possibilities to physically provide support to our users on the ground were quite limited. In summary, building for failure means that we want to work on building applications that can fail rather than building applications that won't fail. The third and last learning that we want to talk about a little bit is that you're not a user. In general, we have this understanding that as a developer, if you have the user in mind, you're more successful. This can be quite tricky when your user has such a different experience from yourself. When we're designing user flows, even subconsciously, we partly draw from our own experience. And when it is difficult to relate to users' needs, it is important to focus on asking questions. Co-creating and co-conceiving the solution with our users at every step is key. We want our users to participate in the ideation and in the design stage of our product. This can be challenging with connection and language barriers, but it saves us time and energy in the end. Partly, we also learned this by failure. When building the first prototype of our platform, we built a sign-up flow that prompted our users for their birth date. It just seemed like relevant information for us and quite common for a sign-up process. We then got the feedback from agents on the ground in rural Madagascar that the birthday requirement actually made it pretty difficult for some users to sign up because not everybody knew their exact birth date. Next to integrating this type of user feedback and doing user research, something that has very positively contributed to our impact and has helped us build products that cater to users' needs is collaborating with stakeholders on the ground early on in the process. Partnering with insurances based in Madagascar has allowed us to learn about their processes and to understand how our tool can facilitate their work. A digital tool needs to support existing workflows and essentially just work for the people on the ground. So rather than align with the way that we think things should be done. We don't want to add more complexity to the workflows, but we want to simplify them where possible. But not only designing requirements works better when you include people that have experience on the ground. When developing software, not surprisingly, more diverse tech teams just build better products and that address the user needs more accurately. Having a distributed team between Madagascar and Germany is a huge advantage for us. It allows us to understand our users' needs better and to address them quicker. Our colleagues in Madagascar aren't only physically closer to our end users and have a better understanding of their living situations, but they're also oftentimes better at communicating effectively with our stakeholders on the ground. Finally, we hope that our learnings and examples of how we put theoretical principles into practice can help others working in the digital development space. We're also not done learning, and we're happy to hear your questions and your thoughts. If you want to learn with us, feel free to reach out to us on our website.